Our emergency department at Ascension St. Thomas it's a very busy place. We're one of the busiest in the state.
We see patients presenting from all areas of the country, socioeconomic status, and background. We see rural patients coming from areas that are underserved in Tennessee. We see suburban and college populations, and then being close to a city, we have those kind of peri-urban presentations as well.
Our residency program, we have family medicine residents at St. Thomas Rutherford. We don't have any other residency programs that are based at this hospital. And so during our off-service rotations at St. Thomas Rutherford, we tremendously benefit from not having to compete, if that's the word you want to use, for deliveries on OBGYN or with central line placement or intubations when we're on our ICU months.
One of our most valuable resources is our faculty's time. So we're going to give you much more of our faculty's time than you are at most other residency programs. When you work with a faculty member one-on-one during a shift, then you not only get so much more face time with them and so much more teaching, but the level of feedback is much more superior when they're able to see everything that you're doing.
We're lucky to have our director who served at the national level. We have physicians such as myself that have served as chief of staff and at the system level, and then we have local leaders. So I think we have really a diversity of leadership experience and ways in which we've led that can be of benefit to our residents.
As a past resident and alumni now, I was the second class, so I was really a part of giving feedback on what works for the program, what maybe needs improvement. They take that feedback, and we've had changes made both in our rotations in the emergency department, our off-service rotations. We've had some major changes that have proven great.
Our residents participate in multiple committees: ethics, safety, quality, and their opinions are not only solicited but valued. They become a crucial member in the development of healthcare policy, in development of quality improvement and safety for our patients.
One of the great things about our program is that all of the faculty are part of a democratic, independent emergency medicine group. And so what that means for the residents is that they really get a front row seat to seeing the way that a community emergency department operates. So things like flow issues and the importance of building collegial relationships with our consultants, being an active part of the medical staff.
At any level you want to get involved, all you really have to do is say the word. And that's been great for me because I am interested in both how healthcare policy gets set on a national level and how healthcare systems work to improve patient outcomes.
There's a big wellness aspect to our program. I mean, it's built into the curriculum. Faculty and residents are aware that wellness is an important aspect of medical training, especially as we've seen there's a lot of burnout among physicians.
We definitely get along really well with each other, and I think you can gauge that from just walking into the doc box, for example. Everyone is, for the most part, in a good mood, sharing, interesting patient cases.
We have several of our incoming residents have families of their own, both male and female, and I think that our program does encourage a spirit of education over service.
Murfreesboro and Middle Tennessee is a fantastic place to live and a great place to train. And then Nashville, just a half hour away, is one of the true entertainment meccas in this country.
When people ask me, why St. Thomas Rutherford, why would you want to train here? I think it's a combination of probably our number one goal is just an excellent clinical education, which I think we excel at. I think it's having a relationship that's one-on-one with attendings on your shift, which I think is an optimal way to learn. I think it's excellent didactics and a willingness as a younger program to change what we do in response to resident input. I think those things make it an excellent place to train.